the Ryan tax changes would not only make the system less progressive, they would make the system regressive. That is, the tax cuts for high-income households would be so large that the average tax rate paid by high-income households would be lower than the average tax rate paid by middle-income households. As a result, what Ryan is proposing is not only that low and middle-income households bear the entire burden of fixing the fiscal gap, but on top of that, they bear an additional burden of cutting taxes for very high-income taxpayers. I personally see no reason why either of those should be true. I see no reason why low and middle income households should bear 100% of the burden of fixing the existing gap, and I even see no reason, if that makes any sense, why they should bear an additional burden of cutting taxes for high income households. On the spending side, I'll get to Medicare in a second. The first place to start is discretionary spending. There are huge cuts in discretionary spending, but they're not specified. Okay, this is the oldest trick in Washington. This is David Stockman's magic asterisk and before that. Okay, if you want to have proposals that cut spending, you got to say where you're going to cut them. So there's a freeze on discretionary spending, but there's no discussion about how that's going to happen. On Social Security, there are two features. One is benefit cuts, and we can debate the exact structure of benefit cuts, but I believe we're going to have benefit cuts, and I don't think Ryan's proposals are so bad there. I would modify them, but benefit cuts have to be on the table. We're going to have benefit cuts. The part of the Social Security proposal that's difficult is the privatization part. This would cost an enormous amount of money. That is, creating the private accounts, the nest eggs that Representative Ryan spoke so warmly about, would make the deficit problem worse. Okay, he acknowledged that when he said that if you didn't do that, you'd free up a lot of money. But there are trillions of dollars on top of the existing fiscal gap. There are trillions of dollars focused on this privatization plan. And on top of that, Ryan's plan would guarantee a certain minimum rate of return on these accounts. Now, Social Security, CBO scored that as a zero cost because they assume that in every year the stock market return is higher than the rate of inflation because they're just taking averages and forecasting them out. The one thing we know is that that's not going to happen. From 67 to 82, the market return was zero in nominal returns. The last couple of years it's been highly negative in nominal terms. So we know there are going to be costs to that, and Social Security has estimated that as another $3 trillion that's not in there. All right, lastly, I want to talk about health care. The discussion, the language is that Representative Ryan would reform Medicare. That's not quite right. He would end Medicare. Right? The defined benefit nature of Medicare would be gotten away with. What it would be replaced would be a voucher that declines in health care value over time, and in the long term would be worth about a quarter. The 2080 number would be worth about a quarter of what the Medicare deal is right now. So what I would like to see is a long-term plan that doesn't involve massive tax cuts for the rich, that involves, if anything, increasing the burden that high-income households can pay. I think the Paris Hiltons and the Kim Kardashians can afford to pay more. They don't need to pay less. I would like to see benefit cuts in Social Security. I don't think privatization adds to the plan. And with Medicare and Medicaid, I think the cuts are draconian, and I would much rather see us close the gap in ways that raise taxes but help the economy.